Hello and welcome to Canine Allergic Dermatitis, creating a higher quality of life for everyone involved in the veterinarian-client-patient relationship with Dana Liska, DVM, DACVD, and that is board certified veterinary dermatologist, Dr. Dana Liska. We are so honored to have her with us today. And I also would like her to just do a webinar on creating a higher quality of life for everyone. So that my suggestion, Dr. Liska, for your next webinar, just, drop the dermatology part and just focus on that higher quality of life, because we're all there for that. I'm Christy Keith, Senior Communications Strategist for Fear Free. And before I formally introduce our speaker, I'd like to quickly take care of a few housekeeping items. First, we'd like to thank our friends and Fear Free sponsors at Zoetis Pet Care for making this webinar possible. This and so many webinars this year, and particularly this amazing dermatology series, of which this is the fourth and last webinar. We'd also very much like to thank all of you for making time to be with us today. We especially appreciate you giving up time on a work day. Thank you so much. Next, CE is available for this webinar, but it is only for those of you who are viewing it live. There is no CE if you're watching the recorded version. For those of you who are here attending live, I'll be sending an email immediately after this presentation that will contain a link to a survey you need to take to get RACE CE. Please listen carefully to what I'm about to say. It will repeat it when you take the survey, but it is something that people misunderstand. In the final question in the survey, not after it, but the actual last question of the survey, there is a link that is to the CE certificate that you can print out and fill in with your name if you need to have some sort of tangible physical document to demonstrate that you received CE for this webinar. However, that does not mean you got CE. Your contact information and your survey responses need to be submitted and forwarded by us to Zoetis, and then by Zoetis to RACE, in order for the CE credit to be official. So just because you printed out your CE certificate doesn't mean you got CE if you didn't submit the survey, fill it out, and put in accurate contact info. So please be careful when you're filling it out that you do that. The survey will close on Friday at 3 p.m. Eastern, so please take it as soon as you receive the email. It'll just take you a couple minutes. If you don't receive an email from us within an hour after this webinar concludes, please contact me right away at fearfreepets@gmail.com. Please don't wait, as if you contact me after the survey is closed, there won't be anything I can do to assist you, and that would make us both sad. The recorded version will be available within around 1 week at fearfreepets.com/webinars. We want to be respectful of your workday time constraints, but Dr. Liska will have time for a few questions at the end, so please ask them as soon as they occur to you rather than hoarding them. We all know hoarding is bad. Use the Q&A window to submit them, although I will keep an eye on the chat window as well. And it is now my great pleasure to introduce our wonderful presenter and someone I have enjoyed working with so much throughout the year, Dr. Dana Liska. Dr. Liska received her Doctor of Veterinary Medicine from Kansas State University in 1999. Following graduation, she completed a rotating internship in medicine, surgery, and critical care at Mission MedVet in Mission, Kansas. She then practiced general small animal vet med for 4 years in Helena, Montana. And in 2004, she began a dermatology residency at the University of Florida College of Veterinary Medicine. After completion of her residency and achieving diplomate status in the American College of Veterinary Dermatology in 2006, she remained at UF-CVM as a clinical instructor of dermatology. She moved to the Dallas area to join the American Dermatology Referral Clinic. For 9 years, she practiced clinical dermatology there, leaving in September of 2016 to join Zoetis. She currently serves on the board of the American College of Veterinary Dermatology as treasurer and as co-chair of the North American Veterinary Dermatology Forum. And of course, she is a Fear-Free certified professional. We're so glad to have you with us here today, Dr. Liska, and I am turning it over to you.
Thank you, Christy, and likewise, it has absolutely been a joy working with you this year. I want to say hello to everyone who is joining us live today, and also a hello to those of you who are going to be listening to the recorded version of this webinar. It is short, it is sweet, and as Christy mentioned, I do believe that we will have time at the end for questions. Today, we are going to focus on 4 things. First, a very quick recap of our fear-free webinar in early September, in which we discussed chronic allergic dermatitis and the effects of stress on quality of life, and not just for dog quality of life suffering from chronic skin disease, but also how owner quality of life can be affected and how it affects your life as veterinary professionals. Second, I will share briefly some additional data at a high level regarding quality of life for dogs and for people. Third, we will delve into specific quality of life data for both Apoquel and Cytopoint, so you will be able to see how both therapies improve quality of life, not only for dogs with allergic dermatitis, but also for their owners. And then finally, we'll pull it all together in a what's in it for you conclusion. In the September webinar, I shared that we now know from a 2016 publication that researchers were able to show the correlation between stress and atopic dermatitis. And they were able to show that dogs with atopic dermatitis had significantly increased hair cortisol levels compared to those of dogs in a healthy control group. And furthermore, the group of dogs that were atopic, they had separated those dogs into 3 different categories: mild, moderate, and severe, based on what we call their CADESI scores, which is just the canine Canine Atopic Dermatitis Extent and Severity Index. And there were patients that were mild, moderate, and severe. And what the study showed was hair cortisol levels in the mild group of dogs was not significantly higher than the control group, but there was a statistical difference in the dogs with moderate and severe atopic dermatitis. In that webinar, I had also shared data on quality of life. And before I just do a quick recap of that, I want to ask you guys a polling question. I would love for you guys to use the chat box that is here on your Zoom screen. And I want to ask you this. When we throw out those 3 words together, quality of life, we fundamentally know what they mean. But individually, I would love to know, what does quality of life mean to you? And I'm just going to pause for a few seconds, get some responses coming in. Share with me some words or phrases that signify quality of life for you in that chat box. So safety, I see the words happy. Lindsay wrote comfort. Tiffany wrote truly enjoying life. I really, really like that, Dr. Tab. I see, is the pet happy and comfortable, being able to enjoy activities of daily life. Jody said relaxed and happy. So I see a lot of comfort and happiness, ability to rest. I love that. Thank you, from Rain. Eating, drinking, again, from Kimberly. Yeah, you know, thank you. Thank you for sharing that, because again, like, we know what it means, but sometimes it's good just to kind of stop and think about it. What we found out in studies of dogs, both with atopic dermatitis and dogs with skin disease in general, we did see those affect quality of life. And for dogs, there were changes in their sleep, their mood, their play, their work. And for owners, researchers saw the impact on the human quality of life in that was felt in money spent on their dog or cat, time dealing with the disease. And the researchers were able to say there is an emotional and physical distress that is associated with living with a dog with either chronic atopic dermatitis or a chronic skin condition. In September, I also introduced for the first time on a webinar the term caregiver burden, and how we know in the human healthcare field, caregiver burden leads to higher rates of depression, anxiety, and stress in people. And I also shared in that webinar that there was a recent publication in January of this year, and the authors wrote, quote, "Our study is able to reveal a link between a pet's chronic disease and caregiver burden for the owner, end quote. So now we know that there is a true measurable caregiver burden in people that are dealing with pets with chronic disease. And to clarify, while dermatology cases were included in this population of dogs in the study, the focus was on dogs with chronic disease. And that might have been internal medicine, it might have been oncology, neurology, again, dermatology, orthopedics, and cardiology. This study looked at the billable and non-billable hours for clients with pets. And what we found out in those clients with pets with chronic disease, of course, caregiver burden goes up. And the expectation is that in clients with patients with a chronic disease, that the need would be greater for services. And so that would result in more billable hours. But the study actually revealed that clients with high caregiver burden required a greater amount of non-billable contact time with you as a veterinary professional. And so while the study didn't look at causation specifically, the author speculated that it must be, it's got to be part of the cause as far as caregiver burden needing more of your time. And what we know is this increases your workload. And according to other studies, we know that this is a primary occupational stressor for veterinary professionals. So the authors suggested more research in the areas warranted. And according to the authors, there was, of the publication, when you put it all together, they shared some very specific steps that we can take to reduce caregiver burden. And what I'm going to do is I'm going to leave you hanging with those steps until the end of the webinar. So stay tuned. We'll talk about what that looks like. So that was our recap. Now I'm going to share some more, again, additional high-level quality of life data. So if we go back to 2010, and this was the days before Apoquel and before Cytopoint, there were a couple of quality of life studies that were done back then. This one specifically was looking at dogs who had atopic dermatitis. And what we learned from that study is that 80% of owners said they were sad about their dog's skin disease. Back in this study, before Apoquel and Cytopoint, 43% said they were worried about the side effects of the therapy. But interestingly, less than 1% of them would consider euthanasia for their pets. So our clients back then were expressing these feelings of sadness and of worry, yet they were telling us that they are committed to their dog's health and well-being. In that same study, we learned that there was a percentage of owners who had not accepted their dog will need lifelong medication. So again, using your webinar, your little chat panel there, tell me what percent of owners do you think you deal with who have not accepted that their dog will need lifelong medications for their skin disease? 80%, 40%. I'm seeing Crystal said 60. I'm seeing 50s and 60s. Kimberly said 60%. Lindsay said 50%. So really high. And you know what? I'm going to share with you guys 100%. I would have absolutely believed that those numbers were going to be high like that, because I feel like a lot of clients and a lot of veterinarians that I talk with through this whole country, tell me that their number one frustration is that they tell clients over and over, this is a disease that we can manage, we cannot cure. And they say it again and again, manage, not cure, manage, not cure. But yet it feels like so many clients aren't recognizing it. Well, at least in this study, we learned that 30% of owners have not accepted that their dogs will need lifelong medications. So I definitely get where you guys are coming from with those higher numbers, absolutely. But what I want to throw out there is, and I'm genuinely interested in this, is how do we get this point across? And if you guys want to share in the chat box how you get this point across with your clients, I would love for you to do so. I'm always looking at this, and yes, I am a dermatologist for Zoetis, but I am always looking at this as how can I, as a dermatologist at Zoetis, and how can we at Zoetis help you message this better to your clients? So again, if you have any great suggestions, I would be happy to take them and share them with our team at Zoetis. Feel free to share, but it is definitely a challenge is getting people to accept this fact. So let's fast forward to a published study about the year 2015. And these are a couple of statistics that were looked at, is what percentage of owners were constantly seeking new therapies for their dog's skin disease, and what percentage of owners would be willing to limit expenses to pay for their dog's therapy. And I think that this is, so I'm gonna go back just real quick because Naomi said what she uses to talk to her clients is telling them about like human atopic dermatitis and using asthma as the fact that there's no cure for asthma, and then maybe they can make that correlation and understand better. And again, Michelle said the same thing, comparing allergic skin disease to other chronic diseases like diabetes and arthritis. We can't make diabetes go away. We can't make arthritis go away, but we can manage them for life. So thank you for sharing both of those to both of you. So again, looking at these studies, and if you think about these numbers, and I think if you kind of stop and think about like, okay, if I poll all of my clients who have dogs with chronic skin disease at any given time, you know, maybe it's May, maybe I do it again in August, we're going to get a range of responses. But if I poll my clients at any given time and I ask, are you searching for a new therapy for your dog's skin disease? Anywhere between 43 and 74% of them are going to agree. And if you do the same thing with the question, would you be willing to limit other expenses to pay for your dog's therapy for its chronic skin disease? At any given time, you're going to have somewhere between 63 and 70% agree that those are true statements. So what this comes back to for me is recognizing that it's our job to offer best medicine and really be focusing on what is best medicine for our patients. So that's all the high level stuff I wanted to share with you. Now we're going to dig into Apoquel and Cytopoint. Some information that I want to share with you that, again, came from that 2015 study that was looking at long-term compassionate use of Apoquel. We're going to play the numbers game again, so you guys get ready to use your chat box again. Again, at any given time, owners completed questionnaires about their dogs, about their dog's atopic skin disease over the course of the study. And I'm going to ask you this. What percentage of owners do you think agreed with the statement, my dog was less playful before starting Apoquel? So throw a number out there that you think would reflect what percentage of your owners would agree that before their dog started Apoquel, their dogs were feeling less playful. And we're seeing 50s, 80s, 100%. Thank you, Samantha. I'm seeing some more 100% from Lindsay, 75% from Rachel. So most of them, Rain, you said most of them are going to feel that way. And it is true. I wanted to share with you the numbers. At any given time, somewhere between 67 and 79% of owners recognize that before starting Apoquel, their dog was less playful. So then let's turn that on the other side. What percentage of owners do you think agreed with this statement? My dog is playful and active after Apoquel. Kelly said 90, Olivia said 75, Laura said 80%. So really you guys are going to the high end of things. And it is absolutely true. It was anywhere between 91 and 94% of owners. And absolutely no doubt, we know which side of this slide we want our patients to be on. We want them to be this cute little pup bounding through the fields, enjoying time outside for sure. So then we'll play the numbers game on the next two slides too. So what percentage of owners said, my dog is constantly waking me up to scratch, lick, bite, or chew before Apoquel? Olivia's at 60%, Laura's at 90%, more 90% from Jody, Samantha said 90%, Ruth is saying 75%. Tiffany, again, was 70%. So yeah, it actually was a really high number. It was this 89 to 98% of clients were complaining that their dog was waking them up at night. I'm sorry, that their dog was waking up. I don't want to confuse it because the next slide is based on the owner's experience. So what percentage of owners said, my dog sleeps better after Apoquel? You guys have been working with these clients. You know, I'm getting lots of 95%, 85%, 99%. So of course, it was this percentage of owners agreed that their dog is sleeping better after Apoquel. So this is probably, I mean, those are important, absolutely, but here is the golden question. What percentage of owners said, I was awake at night because my dog was up, scratching, licking, biting, chewing? Anthony said 95%, 80% for Naomi, 85, 75%. So this was a really high number. 85 to 93% of owners were saying that they were being kept awake at night. We definitely do not want this. But after Apoquel, go ahead, throw some numbers out there. I sleep better after my dog started Apoquel. I love it. You guys are the optimists. 90, 98%, 99, 100% of clients. There was quite a range on this. Interestingly, it was anywhere between 77 and 93% of owners said, I sleep better after Apoquel. And again, we want our patients feeling more playful. We want them sleeping through the night, and we want our clients sleeping through the night also. So always important, always just want to take just a moment to pause and say, we want you to feel so very comfortable with the label, with the important safety information about all of our therapies. If it's been a while since you've checked that Apoquel important safety information, go back, pull it out, look it up online, look at it on the insert inside the package, and make sure you feel comfortable with when and where to use Apoquel. So now we're going to move forward to Cytopoint. And so yes, we are already sharing. It's obvious that quality of life is an important measure to follow for our patients who have chronic skin disease. And yes, Zoetis did a study investigating quality of life with patients on Cytopoint. So what we did is we followed 68 dogs from multiple general practices, and these patients all received 3 injections at Cytopoint at on-label doses, given 3 injections given monthly. The veterinarians who helped with the study evaluated the dogs at day 0, 30, 60, and 90. And what we did is we used validated scales and validated questionnaires, and they were able to measure pruritus. The pruritus visual analog scale is just a long way of saying a pruritus scale. And the scale that was used in this study was a scale of 0 to 100. We used validated tools to assess pet and owner. We assessed both quality of life for both, and we also assessed treatment satisfaction with Cytopoint therapy. So I love sharing this data. So for dogs and their pruritus scores specifically, at day 7, there was a 57% mean decrease in pruritus scores for the dogs receiving Cytopoint. And what we saw is those mean pruritus scores continued to decrease with subsequent Cytopoint injections. And so at day 60, they had reached a mean of about 18.5, and at day 90, the pruritus scores had reached a mean of about 14.5. And so I will say this, as a derm, I never really consider my patients, my atopic patients, to be normal, because it's really difficult to get them and to have owners. I don't want owners expecting their dog to be normal, but I will share that a score less than 20 is, technically speaking, regarded as normal. So earlier, you guys shared your thoughts on what quality of life means, and everyone shared some different ideas. And again, I want you to consider this on a scale of 0 to 100. What would you rate your quality of life right now? And if you feel inclined, go ahead and send it through the chat box. If that's information you don't want to share with me, then you can just keep that number near and dear inside your heart and head. But yeah, if you guys feel like sharing where you think your quality of life is right now at this point in your life, I'd love to see it. Kelly's going for 90 out of 100. That makes me really happy, Kelly. Jody said 85. I reckon about 80 out of 100. That's fair, Sam, because, right, Samantha, we have good days, we have bad days, but overall about 80 out of 100. 95, Crystal said 80. So really, we're here in a good space. Everybody's feeling pretty good about their quality of life. Now, let me share this. What if I told you, you could picture 1 week from now, your quality of life has more than doubled. How does that look for you? How does that sound to you to have your quality of life more than double in the next week? How does that feel to you? Of course, the reason why I ask is because we saw rapid and significant improvement in pet owner quality of life in just the first 7 days, in the first week after pet owners, as far as I'm getting all tongue-tied, we showed that owner quality of life more than doubled in the first week after the first Cytopoint injection. And what we saw from there is quality of life, owner quality of life continued to improve as their dog's itch was reduced. So this study was able to show that there was rapid and significant improvement in pet quality of life and that the burden of care was reduced for pet owners. And what I love about this slide is looking at the statistic that 60% fewer concurrent therapies were being given in the 3rd month of Cytopoint treatment as compared to prior treatment. And you think about that, achieving that for your clients, if you could get their dog to a place where they were giving 60% fewer therapies, those are the reasons why we believe we saw this improved owner quality of life. So, you know, there is this quantifiable information that we've been talking about burden of care and the burden that goes with a caregiver with a dog with chronic disease. But moving away from that biomedical speak, there is just as importantly the need for an empathetic response to our clients. And again, I'd like you to think about this. When an owner visits the breeder or goes to the shelter or goes to the rescue group to pick out this new puppy, in the owner's mind, when they pick out this puppy, this is what the future looks like. A dog that can sit on their lap, a dog that they can take in the car and run to the bank or to Starbucks with. This dog is going to go to the groomer and they're going to go on walks with this dog. When they get this puppy, they never, ever believed it would be this. They didn't believe it would be 11 years of infections and odor and hair loss and food trials and allergy tested followed by immunotherapy and medications and baths and on year after year. So this is Coco. He is an 11-year-old male Shih Tzu. He looks like nobody has done anything for him, but he is actually a patient that they had done everything for. They had done the steroids, they had done the cyclosporin, they had done the Apoquel, they had done the allergy testing followed by immunotherapy. They had done the hypoallergenic diet trials. They had committed to this dog's life, and they were at the point where they were considering quality of life and they were considering euthanasia for this dog. So his derm recommended a Cytopoint injection. Cytopoint came along just at the right time. And as most of us do, she recommended that Coco have a 4-week recheck. So when 4 weeks came and 4 weeks went, there was no sign of Coco. And so she had presumed that they had chosen euthanasia. Now, many of you will know this, and I know that there's some derms. I noticed your names. Noticed some derms on the webinar. And for those of you who may or may not know this, but generally speaking, most of us derms do not like to deal with death and dying. Or I should say, I know as a dermatologist, I don't like dealing with death and dying. So true to dermatology form, this veterinary dermatologist did not call the family to follow up. But you'll be happy to know that the family called her office at 7 weeks to report that he was doing well, but that he was getting itchy again. And so she said, well, let's get him in here. And when Coco came in for his 7-week recheck, this is what he looked like. And in an interview at a later time, the owners went back, we went back and interviewed the owners, and they said something to the effect of, and again, I might be paraphrasing, but they basically said something to the effect of, Coco is like a new dog and we enjoy having him around us again. Like, I just love this story. I do think he still has the saddest, sweetest eyes. He's probably just thinking, why didn't we have this 11 years ago? I'm sure if I could give a voice to Coco, that's what I'm sure he's thinking. So now it is time to bring it all together with the what's in it for you. So one of the first things that the study that I'd referenced earlier was when we are not clear and purposeful in our conversations. So when we're using unclear communications, and let me give you some examples in dermatology. What I mean for that for a derm patient is instead of saying your dog has allergies, because right, if we just say allergy, we know truthfully the owner is going to go home, they're going to Google dog, allergy, and itch, and they're going to get all sorts of recommendations off the internet that don't work for your patient. So for fun, let's go ahead using the chat box. What are some of those things that you would expect to find if you did a Google for dog, allergy, itch? Grain-free diet, coconut oil, baths, essential oils, all of those things. You guys are right there with me. Okay, but I'm digressing. So using your communications, instead of saying your dog has allergies, say your dog is allergic to flea bites. And don't be afraid to say it because it's the medical truth. From what you shared with me, your dog may very likely have a food allergy. And then I love seeing you and I love seeing your dog, but until we change your dog's diet to this specific prescription diet, we're going to continue to run this cycle. Tell them your dog has seasonal environmental allergies, and we call this disease atopic dermatitis. Those are the things that we need to be very clear and specific with our communications. When we choose to do therapies based on what we always do or what is easiest for us, and we don't consider the owner and the pet as a pair, let me give you another example. We all know that bath therapy for secondary infections is so effective, and I love it because it helps us avoid systemic antimicrobials. But recommending bath therapy for every single patient without first asking the client, can you give your dog a bath every other day for 10 minutes? And really, honestly, more importantly, will you give your dog a bath every other day for 10 minutes? Because sure, I can give my dog a bath every other day for 10 minutes, but will I do it? Those are different questions, and you might get completely different answers to each. These are the things that increase caregiver burden. And when we have that increased caregiver burden, it leads to the increase in non-billable hours that the clients need from you as veterinary professionals. So this decreases quality of life for you, the owner, for you, for the pet, and it just continues that cycle of confusion, the revolving door of resentment, them looking for another veterinarian to help them with their derm disease, and the emotional roller coaster. These are the things. And probably at the top would also be clear communications. As soon as you recognize a dog has chronic skin disease, to say there are veterinary dermatologists out there, and this is the perfect time for you to go see them so we can get this under control. But instead, we want to have those open-ended questions. We want to consider the client's routine. When we work with the client's routine, we can work with the owner to create that sustainable treatment plan. I didn't share this today, but in the September webinar, I shared this, and I'll go ahead and do that now. But remember, when it comes to chronic disease, clients feel that following, and again, I'm paraphrasing this, but basically, when they have to adhere to new rules and routines, they find it challenging. So work with them to develop the treatment plan. They're more likely to adhere to the treatment plan if they are a part of creating it. Today, I was able to share with you how Apoquel and Cytopoint improve that quality of life for both pet and owner. And when we do this, and when we're looking for the owners with the caregiver burden, and we look for ways to improve their quality of life and decrease that burden, and taking that time to share an empathetic response with your clients and share that empathy for the situation that they're dealing with, all of those things will help decrease the burden. And when they need fewer non-billable hours of your time, we can improve your quality of life, and then we see quality of life improve for everybody. So that is the path that we want to move forward on, not the cycle of frustration. So wow, I think with Christy's, with all our polling and with Christy's comments, I think we hit right at 12:30. So tell me, what questions do you guys have?
First of all, we do have some questions, and I want to say that's the nicest animation I have seen in a long time.
Oh, it's so fun, isn't it?
This is beautiful. Great job. And great job with the whole presentation.
Thank you, Kirsty.
Thank you. So we have 3 questions, and 2 of them just popped in, and one of them's been there a while. We'll start with that one, and those are the only 3 we're going to do because we're already a few minutes over. So the first question is about a specific patient, a 12-year-old Pomeranian who's on Apoquel once daily and Cytopoint. The owner is bathing with Phytovet CK shampoo weekly. She sees the dog scratching a lot. Owner does not want to do, what is it, allergen, ASIT testing. What is that? I can't even remember.
Okay. Allergen-specific immunotherapy.
Thank you. I knew it was something like that, but I couldn't remember what it stood for exactly. Chronic itch since moving to Hawaii. The dog is on Bravecto, and the owner says Cytopoint only helps for 2 weeks. So any thoughts on this case, Dr. Liska?
Yeah, so definitely, I mean, to me, for all of these patients, it has to go back to the diagnostic workup. And if this is a year-round, non-seasonal problem, then we do have to consider a food allergy. We have to be intentional with our flea and tick therapy. And I will say the new class of flea and tick therapies, the isoxazolines, as a derm, I love them. I think most of my derm colleagues love them too for their safety and their efficacy. Managing infections and you know, they pop up from time to time. So if the dog isn't doing well, looking for staph, and especially looking for a yeast overgrowth. I think that's one of the biggest culprits to therapies making it look like it's not working. Again, if it's a non-seasonal problem, considering and doing a true 8-week hypoallergenic diet trial for that dog, and then considering that at the age of 12, it's moved to Hawaii and maybe it's just developing atopic dermatitis. To your point of the Cytopoint only working for a couple of weeks, what I can share with you is there was a study out of Colorado State University that was just published just basically a year ago. And looking at dogs on Cytopoint, we recognize, out of Colorado State University, again, this was not a Zoetis study, but as derms, we recognize that basically 80% of patients are going to get 4 to 8 weeks worth of relief out of a Cytopoint injection. So it's only your patient, your Pomeranian, is one of the 20% that is not getting a full 4 weeks worth of relief. And I believe the 2-weekers are like 4% of dogs. So your patient, the Pomeranian, is just in that small subset of dogs where they're not quite getting the relief they need. So the diagnostic workup, commit to it, make sure that you're controlling flea, tick, and infection as they come around, and then is it food, is it atopic dermatitis, and managing those diseases the best you can.
Great. And I left out, and I apologize for this, that she was specifically asking, can she give the Cytopoint every 2 weeks?
Oh, okay. Well, so that's an off-label conversation. And so what I would love for you to do is, definitely, I guess,
why don't you go to the Zoetis website?
Yes.
And I think something there and see.
And what I was going to say would be your area veterinarian for Hawaii. Your area rep, contact that person, have that person get in contact with your area veterinarian, because your area veterinarian is best able to have that conversation with you off label.
Great, thank you. And I'm sorry for asking an off label.
No, Chrissy, not at all.
Yeah, okay. So here's one. Your thoughts on probiotics, especially with puppies with dermatitis, does it help lessen future occurrence, so less severe or frequent?
You know, there's just been very little work done there, and there's one I can think of, and it's been quite some time. So I definitely don't want to overstep my bounds, but I believe in the study there was, these were laboratory beagles with a lab model of atopic dermatitis. And there was a breeding pair that had a litter of puppies. And in the first part of the study, the female received probiotics throughout her pregnancy. And I believe they showed the probiotics helped those puppies that were born subsequently after the mother had been on probiotics. They took the same breeding pair. The mother did not get probiotics during her pregnancy. And I think that they showed that the puppies in that litter had a more severe disease, I'll say, of atopic dermatitis. And so and I'm not aware of anything post, like, I'm not aware of any other studies like that have been done since then. So it would suggest that we would have to give the probiotics to the pregnant female. So, and I think that's the best answer I can give you from there.
Dr. Michelle Rosenbaum just added in the chat, talked to their technical services veterinarian at Zoetis, used very high doses of probiotics, like 10 cultural pills a day.
Gotcha. So yes, thank you very much, Dr. Rosenbaum. She is one of my colleagues at Zoetis. Thank you for stepping in there. Absolutely, talk to your technical services vet at Zoetis. And then what she's sharing, and I didn't remember this, so thank you very much, is that study, they were giving that female dog very high doses of probiotics that maybe wouldn't be sustainable. So thank you for sharing, Dr. Rosenbaum.
Great. Yes, thank you. So here's our last question, everybody. When do you transition from Apoquel to Cytopoint, and how do you explain that to the client?
Oh, okay. So really, because both are, I'm going to say as a dermatologist, I probably find myself being, reaching for Apoquel first, just because I love the way I can stop and start it while I'm doing the diagnostic workup. But keep in mind that both therapies, Apoquel and Cytopoint, are labeled for dogs with atopic dermatitis, and both are labeled for dogs with allergic dermatitis. So probably the way I kind of look at that question is I'm probably going to reach for Apoquel first, but where am I going to just go to Cytopoint? Dogs who are less than 12 months of age, because of course, Apoquel is labeled for dogs older than 12 months of age. I can use Cytopoint injection in any dog of any age. Dogs where they are difficult to medicate, and it makes sense for me to give them an injection of Cytopoint. For owners that are not going to be compliant, maybe just to their heart, they're not going to be compliant, or they just full on admit they're not going to be compliant. Maybe dogs that have a lot of other health issues and they're getting a lot of other medications, and I'm looking for ways to decrease caregiver burden. Dogs that maybe have some severe diseases. I've had some very interesting cases over the year, dogs with deep infections, dogs with immune-mediated disease, and the internal medicine specialist didn't want me to, change their protocol plans by adding steroid, Atopica, Apoquel. Those would be patients that I could see really just, and again, just really looking at the owner and the dog as a pair together, and does it make sense, in improving caregiver burden to go with Cytopoint.
Great. Well, thank you so very much. This was incredible. And thank you for all the great information we got throughout this series. And don't forget that I'm anticipating a higher quality of life for everyone webinar from you soon. But we really want to thank all of you who are here with us today. Please don't forget that I will be sending out the CE email within the hour, and remember to email me at fearfreepets@gmail.com if you don't receive it. The survey is only open until Friday, so please take it right away. We want to thank all of you for being here, and Zoetis Pet Care for making this entire series, including this presentation, possible. Thanks again, everyone, and we hope to see you at our next Fear Free webinar. Have a great rest of your day.